I'm Christine Pryor, and I'm the social worker in both the pediatric and the adult cystic fibrosis clinics at UVM Medical Center. And we started screening for depression and anxiety in the pediatric clinic in May of 2014 and in the adult clinic in July of this year. When we decided to start implementing the screening, initially we sent a letter to all of our patients and all of our caregivers, and we followed that up by having an article in our newsletter to explain that the depression and anxiety screenings would be starting in clinic and what that process would look like. Patients and caregivers were not surprised to hear that patients with cystic fibrosis and their caregivers are at an increased risk of having symptoms of anxiety and depression. It's something that they've recognized and felt for a long time, and I think they feel validated having us recognize that. Our care center has not found that the implementation of the depression and anxiety screening has impacted the flow of clinic in a negative way. The screening tools take maybe 3 to 5 minutes to complete. It really is not lengthy. It's very easy and very quick. I review them at a time when the patient and their caregivers are being seen by other providers, so that really doesn't impact the flow at all. And then I go back later in the visit when there's a break and talk about the results. After I score the depression and anxiety screenings, I make sure to talk to the providers about the results. And I think that information gives them a bit more clarity into who their patients and their families are. And we ask a lot of these patients, and it's really important and helpful information for providers to know where they're at in terms of their mental health. When we started to think about implementing depression and anxiety screenings, the biggest barrier that we found was trying to figure out what we were going to do with the elevated scores. So what we did here is we reached out to our psychology department and we asked if they'd be willing to partner with us so we could come up with a plan for patients who did need additional support. If patients live far away or do not want to come back to meet with a psychologist here, some other options that we offer is I'm happy to call their primary care doctor and see what their thoughts are about therapists who live locally. We have a huge catchment area here in Vermont. We serve all of Vermont and upstate New York, so I don't know therapists in all of those areas. But I'm happy to either, refer people to their PCP or call myself and see who they might know in that area, or also refer people to their local mental health counselors. I also often, for children and for adolescents here in Vermont, there's often therapists that are school-based that also can be a good option. So there are alternatives if it's not realistic for patients to come back here to meet with our psychology department. I think that screening for depression and anxiety is really important. It's been important for me as a social worker because I think it has allowed me to get to know my patients and their families on a deeper level. It's allowed patients to know that their mental health is something that they can talk to me about. When you have a parent who is well cared for emotionally and you have kids who are well cared for emotionally, they're going to better be able to be adherent to the complex, lengthy, time-consuming treatment regimens that we're asking them to do.